Good evening, and welcome to Wednesday Wellness, a free live educational series by Trinity Health. We're pleased to have you join us as we discuss mental health and take a closer look at anxiety and depression. Before we get started, here are a few housekeeping notes. Your cameras and microphones have been turned off to ensure a smooth experience. If you have questions during the presentation, please use the Q&A chat feature at the bottom of your screen. Questions will be addressed at the end of the presentation. Lastly, today's webinar is being recorded, and a link to the video will be sent to your email. Without further ado, I am pleased to introduce Sarah Wiggers and Martina Anderson, licensed clinical social workers with Trinity Health.
Hi, my name is Martina Anderson. I'm a limited licensed Master of Social Worker here at Trinity Health in Grand Rapids. I've worked here for 2 years and earned my Master of Social Work degree from Grand Valley State University in 2023. I'm dedicated to supporting individuals through some of their most challenging moments, and I specialize in crisis intervention, mental health, substance use, and resource coordination. I'm especially committed to creating a safe space where people feel heard and supported in seeking help. I'm grateful to be here and look forward to sharing with you today.
And I'm Sarah Wiggers. I am also a social worker and a certified addiction counselor at Trinity Health Grand Rapids. I got my MSW from Portland State University and have been working in mental health and substance use for a while now. My background includes harm reduction, trauma-informed care, and crisis work. And I'm really passionate about meeting people where they're at, breaking down stigma, and making sure no one feels alone and what they're going through. And I'm thrilled to be here with you all today. So we are going to dive into depression and anxiety, what that looks like and its impact on us in our everyday lives. We are going to name and walk through some different coping strategies, how to monitor our symptoms, and when we monitor those symptoms, when we should seek professional help, as well as discuss different treatment options, and both online and resources here in West Michigan. So without further ado, I'll have Martina jump in here on depression.
Yeah, so first we're going to start with just some education on depression. And I want to start with clearing up a very common misconception. Depression is a serious medical condition. It's not just a bad day or a rough patch. It affects how people think, feel, and function. Unlike normal sadness, which usually passes with time, depression can last for weeks or months and interfere with your everyday life. It's not something that you can just snap out of or with willpower or positive thinking. Depression is influenced by brain chemistry, genetics, life stressors, and many other factors. It is not a personal weakness, it's a health condition. And like any chronic illness, it deserves to be treated with real treatment and support, such as therapy, medication, or lifestyle changes. Ignoring it does not help, but recognizing it and addressing it does. Depression can also affect your mood, thoughts, and daily life. It doesn't only affect your emotions, it changes how a person thinks and as well as experiences and interacts with the world. People may feel worthless or see themselves as a failure. They may believe that things will never get better and lose motivation to do even basic tasks. Sometimes responsibilities such as showering, going to work, or responding to texts can feel overwhelming. Depression also has a huge impact on a person's mood and can create people to feel as though they're quickly moving from one emotion to another. This can also cause increased symptoms of irritability and annoyance. People can lose patience quicker than others and lose their temper over things that may seem small. Another symptom is feeling hopeless or empty. Depression often brings a heavy sense of hopelessness and emotional emptiness or numbness. It's not just about feeling sad. It can feel like being stuck in a fog or being disconnected from everything. People may feel like nothing matters, that nothing feels meaningful or enjoyable. These feelings may make it difficult to seek help. Along with that, people can often feel as though they have a loss of interest in things that they once enjoyed, such as hobbies, time with friends, or even food or music. This isn't about laziness, disinterest, or the person being difficult, it's that depression physically and mentally blocks the ability to feel pressure. It's a symptom called anhedonia, and it contributes heavily to social withdrawal and isolation. Depression can also cause low energy or fatigue. Fatigue is one of the most reported symptoms of depression. Many people feel physically and mentally drained, no matter how much rest or how much sleep they get. It's more than just being tired. It's a deep exhaustion that makes it physically, mentally, and emotionally hard to even do simple things like getting dressed or running errands. Similarly to that, people have trouble sleeping or sleeping too much. And again, way back to the energy fatigue, although always feeling like no fatigue, sometimes people can't sleep or are sleeping too much. And when people don't sleep enough, they still feel unrefreshed. Both extremes can be part of depression, and irregular sleep often makes the symptoms worse. Poor sleep adds to difficulty concentrating and emotional stress, creating a cycle that's hard to break. People also might experience a change in appetite and eating habits. Some people eat less or lose their appetite completely, while others may eat more, often turning to food for comfort. These changes can lead to noticeable weight loss or gain, and often go hand in hand with emotional distress, such as shifts in mood or energy. They can also reinforce feelings of shame and reduce physical well-being. Another symptom of depression is difficulty concentrating or making decisions. Cognitive symptoms are often frequent and overlooked. Depression can make it hard to concentrate, remember things, or even make small decisions. This can affect work, school, relationships, and confidence, and it adds to the frustration and shame that people may already be feeling. People with depression also carry deep feelings of guilt or worthlessness. They may blame themselves for their symptoms or feel like a burden or think that they're failing at life. These thoughts are symptoms of the illness, not reflections of reality, and yet they can be some of the hardest to overcome. Finally, people with depression can experience thoughts of suicide and death. And they can also experience thoughts of self-harm, such as cutting or burning. Thoughts of suicide and death can be a range of thoughts, such as, I wish that I could go to sleep and not wake up, to the extreme of, having a plan or intent on how you would end your life, and often tying into the feelings of guilt or worthlessness, feeling as though that would be okay. Experiencing symptoms of depression is not a sign of weakness and is not anyone's fault. It is a real condition that can affect your energy, sleep, appetite, focus, and how you see yourself in the world. If you're feeling overwhelmed, hopeless, or just not like yourself, you are not alone, and you don't have to go through this alone. Depression is common, and it's treatable. As we will discuss in a few slides, there are many ways to reach out for support and to receive help.
Okay. Moving from depression to anxiety. Anxiety disorders are often misunderstood as just over worrying, when in reality, it's a complex condition involving both psychological as well as physical symptoms, racing thoughts, chest tightness, restlessness. It can hijack focus, sleep, and even day-to-day stability. It's no longer about nerves before a big meeting. It's a consistent undercurrent that can wear people down. Telling someone to just relax isn't just unhelpful, it ignores the clinical nature of the disorder. Anxiety requires a clear-eyed approach, including evidence-based treatment, practical support, and a serious shift in how we talk about it. Anxiety is a normal reaction to stress. It is a totally natural response, and it is a part of the body's natural defense system. So it helps us prepare for challenges like studying for an exam or reacting to danger. But when anxiety is triggered too easily or lasts too long, or even if it is wildly out of proportion to the situation, it can cross into disorder territory. So instead of being helpful, it starts to get in the way of daily life and becomes a barrier to functioning, and becomes something we have to cope with, not unlike depression. Anxiety helps us prepare for danger or challenges, but when it becomes consistent or overwhelming, it can get into everyday life. So chronic activation of fight or flight. Human stress response is designed for short bursts of action. It is not for long-term endurance. But with chronic anxiety, the nervous system remains in a state of alertness, even without a clear or present danger. And that response simply doesn't shut off. So people often describe feeling on edge, feeling overwhelmed, being hyper aware, and that they worry about things that they feel are completely out of their control. Over time, this constant state of vigilance takes a serious toll on mental and physical health and can impact relationships, work, sleep, and even how you view the world. It involves constant and excessive worry or fear. It isn't simply about having a lot on your mind. It's a relentless cycle of worry that feels intrusive and uncontrollable, like being stuck in a constant loop. This worry might be tied to specific issues like finances, health, or safety, or it might feel vague in general. Either way, it's exhausting. And the brain stays busy scanning problems that may not even exist, leaving little energy for anything else. Restlessness or feeling on edge. Anxiety shows up in the body as much as it does in the mind. People often describe a sense of internal buzzing, like being jittery or tense, or feeling like they can't sit still or relax. There may be a strong urge to pace, fidget, or move constantly, like being in go mode, even in otherwise calm environments where there is a lot going on. This restlessness reflects the body's attempt to discharge nervous energy that's nowhere productive to go, not unlike my shaking foot as we're doing this presentation. Racing heart or fast breathing. Anxiety is a full body experience. Symptoms like rapid heartbeat, chest tightness, shallow breathing, sweating, dizziness, or gastrointestinal discomfort are uncommon. These responses are part of the body's autonomic stress system, and they can be frightening, especially when they occur without an obvious trigger. And it's not just in your head. This is a totally natural neurobiological event. Like depression, anxiety can cause trouble sleeping. One of the first casualties of chronic anxiety is actually sleep. Many people lie awake and struggle to fall asleep. They wake up frequently during the night, arise just feeling as tense as when they went to bed. Racing thoughts and physiological arousal, so think increased heart rate or blood pressure, make true rest difficult. And without restorative sleep, anxiety intensifies, creating another feedback loop that's difficult to break down. There's difficulty concentrating. Anxiety clutters cognitive brain space. It crowds everything else to where it becomes hard to stay focused, develop conversations, complete tasks, or make decisions. Some people describe it as brain fog. Others constantly being pulled into mental distractions. When the brain is consumed without threat scanning, it can't devote energy to complex or creative thinking and becomes mentally exhausting. And muscle tension. So chronic anxiety often manifests as physical tension in the body. You might recognize having tight shoulders, clenched jaw, stiff necks, and lingering aches and pains. And this constant tension is part of the body's protective stance and over time contributes to fatigue, pain, and even postural issues, which then further compound stress with a general sense of discomfort. Lastly, anxiety can lead to avoiding certain situations out of fear. So to manage anxiety, people will begin avoiding crowds, social events, work demands, even everyday activities. Not because they don't want to be involved, but because the fear of feeling anxious becomes too overwhelming. So while this avoidance provides short-term relief, it reinforces the brain's belief that the avoided thing is dangerous, making anxiety worse over time. So as the avoidance expands and we continue to avoid more and more things, it can shrink our world and it, once again, make anxiety feel more powerful. Anxiety is common, it's treatable, it's nothing to be ashamed of. While some level of anxiety is part of the human experience, chronic anxiety disorders are disruptive and deserve clinical attention. They affect how people think, feel, function, and relate to others. And importantly, anxiety isn't a weakness. It's a condition rooted in neurobiology and shaped by environment, genetics, and stress. So with the right tools, which we'll talk about, people can experience real relief. The first step is taking anxiety seriously, and the second step is knowing that help is available.
So it's very common for people to experience both anxiety and depression together, and that can make things feel even more overwhelming. This diagram shows how they can look different, but also where they overlap. As we've discussed, depression often includes symptoms like sadness, low energy, feelings of worthlessness, and thoughts of suicide and death. Anxiety, on the other hand, can be more about worry and fear. You might feel nervous, have a racing heart, sweaty palms, or feel like something bad is going to happen. But if you notice the middle section, this is where the two meet. Anxiety and depression often occur together, and it's not uncommon for someone to experience symptoms of both at the same time. While they are separate conditions, they share many similarities. Again, such as trouble sleeping, fatigue, irritability, difficulty concentrating, and the physical symptoms such as muscle tension or stomach issues. When anxiety and depression overlap, a person might feel stuck in a cycle of anxious thoughts and low moods, which can make it harder to cope with daily life. Understanding this connection is important because treating both conditions together, again, whether that be through therapy, medication, lifestyle changes, or a combination of them all, can lead to a better and more lasting relief.
All right. So now on to more of the coping skills aspect. So experiencing symptoms of anxiety and depression can have a huge impact on our life and oftentimes be debilitating. But there are tools that we can use to help lessen these symptoms. Things that we call coping or grounding skills. These skills are used to calm our nervous system when we're heightened or overwhelmed and work to help regulate thoughts, feelings, and emotions. Coping skills can be something that you do by yourself, such as breathing, sleeping, or meditation, or something involving other things or people, such as reading, watching TV, or spending time with loved ones. These are just examples of some coping skills. So we have reading, exercise, even just 20 to 30 minutes of walking can boost your mood. Participating in hobbies such as sports, gardening, drawing, hiking, playing with a pet, or cooking. Breathing, there are two easy popular techniques. One is 4-7-8 breathing, which we will talk about and walk through here in a moment. And the other is square or box breathing, which again, we'll bring up. Writing, meditation. Meditation is something that you can, slowly work your way into, and you can also use apps like Headspace, Insight Timer, Calm, or even YouTube to help you through some guided meditations. Sleeping can be a coping skill as long as one of our symptoms is not sleeping too much. Self-care, things like tending to your hygiene, simple things like brushing your teeth, taking a shower, getting dressed up, or getting a haircut. Journaling, thought records, which are records that we keep to help identify patterns over time that can help us learn what might be triggering or leading to increased symptoms of depression and anxiety. Listening to music, spending time with others, such as calling or texting a friend, organizing a group dinner, visiting family, or joining a club or a group. Progressive muscle relaxation, which is tensing and relaxing different muscle groups in your body, one muscle group at a time, and then pausing to notice a difference. So an example of this would be stopping and clenching all of the muscles in your feet, holding it for a minute and letting go, and acknowledging the difference between when you clenched your feet and when you didn't, and then moving on to your legs, to your torso, to your hands or your arms, and going one muscle group at a time, targeting that muscle tension and tightness that we talked about. On the go, you can use sour candy. the shock of sourness interrupts racing thoughts and brings you back to the moment. Then there's 5, 4, 3, 2, 1 grounding, which is where you pause and name 5 things that you can see, then 4 things that you can touch, and then 3 things that you can hear, 2 things you can smell, and 1 thing that you can taste. And if you're not in a situation where you can taste something, then you can name 1 thing that you like about yourself. Fidget tools. Common ones are fidget spinners or putty. Some people might find things like feeling textured fabric is something that calms them down, or utilizing weighted blankets or pillows. It's important to find 1 or several skills that work for you. And rather than just talking at you, Martina and I want to include you a little bit. So now that we've talked through some of these coping skills, we want to walk you through one. And that's that 4, 7, 8 breathing. I also mentioned that I would touch on square breathing. So square breathing is when you inhale for 4 seconds, hold your breath for 4 seconds, exhale for 4 seconds, and hold that for 4 seconds. Similarly, 4, 7, 8 breathing is designed to help regulate your nervous symptoms. And this is using a 4, 7, 8 count. So when you're feeling overwhelmed, anxious, or emotionally flooded, it can be a great technique in the moment. And with practice can become a reliable part of your self-soothing toolkit. So we're going to walk you through this exercise. You'll inhale through your nose for 4 seconds, hold that breath for 7 seconds, and then exhale slowly through your mouth for 8 seconds. And we'll do this for 4 full rounds together. So go ahead and get into a comfortable seated position if you aren't already. If you feel okay doing so, you can gently close your eyes or lower your gaze to reduce distractions, since we are all staring at a computer. So let's begin by exhaling all the air out of your lungs. So just take a simple, gentle breath out. And then inhale, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, and exhale, 2, 3, 4, 5, 6, 7, 8. Inhale, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Inhale, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Last round. Inhale, 2, 3, 4, hold, 2, 3, 4, 5, 6, 7, and exhale, 2, 3, 4, 5, 6, 7, and 8. Now let your breath return to its natural rhythm. Notice how your body feels. Maybe it feels a little heavier, a little more grounded, or even just a bit more still. So you can come back to this technique whenever you need to reset, before a tough conversation, at bedtime, or anytime your body needs a signal that it's safe to slow down. So let's take one final deep breath in together and out. And when you're ready, bring your attention back to the room or to your screen. So some people might not notice a big change in themselves right now, and that's okay. Oftentimes techniques like this do take practice until you can get into the rhythm. And I will turn it over to Martina.
So now that we've kind of talked about some tools that you can do on your own to manage your symptoms, now we want to talk about when to seek professional help. Again, it's important to understand that anxiety and depression are medical conditions, just like diabetes or high blood pressure. If your symptoms persist or begin to interfere with your daily life, it's not a sign of weakness, it's a sign to get support. When talking about anxiety and depression, the time frame of your symptoms matter. If you're having feelings of anxiety or depression and they last for more than 2 weeks without any improvement, that is when we would recommend considering getting professional support. How it's affecting your functional impairment. Another big indicator is when you find yourself struggling to get through the day, whether that be work, school, or even small daily tasks like cooking, showering, or returning messages. That functional disruption is a strong sign that your mental health needs attention. Kind of along with that is loss of enjoyment and social withdrawal. If you notice that you stop doing things that you used to enjoy, such as hobbies, time with your loved ones, or other social activities, that is what we consider a significant shift. As mentioned before, that symptom of anhedonia, or the loss of pleasure, is a hallmark of depression. Another thing to kind of look out for is using unhealthy coping strategies. Sometimes people start leaning on unhealthy coping methods, such as using substances, engaging in risky behaviors, or avoiding things altogether. These might seem like temporary relief, but over time they worsen symptoms and can make recovery more difficult. Finally, hopelessness or suicidal thinking. If you are experiencing thoughts of hopelessness or any thoughts of self-harm or suicide, that is an emergency signal. Help is available and support can make a life-changing difference. Again, this is not something that you have to face alone. Along with that, we want to include simple tools that you can use to check in with your mental health, just to kind of check in and see how you're doing. Sometimes it's hard to tell when what we're feeling is just stress or something more serious. In our clinical settings, we often use tools such as the PHQ-9 or the GAD or the GAD-7 for anxiety. These are quick, validated questionnaires that help quantify symptoms and track your changes over time. The PHQ-9 is a 9-question checklist that looks for symptoms of depression. It monitors things like low energy, feeling hopeless, sleep changes, and thoughts of self-harm or suicide. It's based on how you've been feeling over the past 2 weeks. Similarly, the GAD-7 for anxiety asks about symptoms such as constant worry, restlessness, or feeling like something bad is going to happen. Again, it's a quick check-in. This one is only 7 questions. These are the same tools that are used in doctor's offices, mental health clinics, and hospitals, but they're simple enough for you to use at home anytime. They will not give you a diagnosis and they won't tell you what you have, but they are a great way for you to track how you're doing and whether it might be time to talk to a professional. Each question asks how often you've had a certain symptom in the past 2 weeks, such as, again, the loss of interest, feeling anxious, or trouble sleeping. And you just check how often that's been a problem for you. Not at all, several days, and so on. It's very straightforward. At the end, the scores add up. The higher the number, the more severe your symptoms might be. If your scores stay high or keep increasing, again, that's a clear sign to reach out for help. You do not need to wait until things are unmanageable. These tools can help you spot patterns early so you can take action sooner and feel better faster. I always encourage people to take them once every week or 2 if you've been feeling off or, again, unsure as to whether it's stress or something serious. You can print them out or use a free online version and then bring them to your doctor or a therapist or a counselor, again, or any health professional, and it can make the conversation a lot easier. You want to think of the PHQ-9 and the GAD-7 like emotional health check-ins. You don't have to guess how you're doing. These tools help you see it clearly and take back some control.
So treatment for these symptoms and anxiety, symptoms of depression and anxiety that we've gone over pretty heavily vary based on your needs and ultimately your safety. These options listed here are the most common options available in our community. The first is talk therapy, which involves meeting with a mental health professional to talk through how you're feeling. It's a safe space to explore your thoughts, emotions, and experiences. And a big part of therapy is learning how to understand your thinking patterns and how it affects your mood and behavior. So that over time, you can develop new ways of thinking and coping skills that help you feel more in control and better able to handle life's challenges. What I always encourage people to do here is to counselor shop. There is not a one size fits all when it comes to a counselor. One counselor may be fabulous for one person and terrible for you, and that's okay. It's okay to see someone and say, this isn't working, and try somebody else. Another is psychotropic medications. These types of medications help with mental health conditions like anxiety and depression. They work by affecting the chemicals in your brain that influence mood, stress, and emotions. For example, anxiety or antidepressants can help boost your mood and energy over time, while anti-anxiety medications can reduce feelings of worry or panic. These medications don't change who you are. They're just meant to help you feel more balanced so it's easier to function and cope with daily life. And just like counselor shopping, not all medications are going to work for each individual. So if one medication doesn't work for you, don't get discouraged. Work with your provider on finding another medication. And note that some of these medications do take weeks to build up in your system, and it's not just a quick fix. The next is intensive outpatient. So this is a structured treatment program where individuals attend therapy, such as talk therapy, group therapy, and possibly use these medications and medication management several times a week while still living at home. Typically, that looks like 3 appointments per week. It's designed for those who need more help than traditional therapy, but aren't requiring a higher level of care, such as needing to be admitted somewhere 24/7. The next step up from intensive outpatient is a partial hospitalization program. It's also known as PHP. It is more intensive than an intensive outpatient and usually runs 5 days a week for most of the day, similar to a full-time job. So think, 8 to 4 or 9 to 5. It provides comprehensive care, including therapy, medication support, and psychiatric evaluations. And people return home in the evenings to go back in their own bed with their own family and their own environment. It's often used as a step down from inpatient care, which we'll get to next, or when symptoms are too severe for regular outpatient therapy. Crisis stabilization is for individuals experiencing a mental health emergency, such as suicidal thoughts, panic attacks, or severe depression. The goal is to quickly ensure safety and stabilize the person's condition in short-term intensive setting, providing 24/7 care for no longer than 72 hours. So this doesn't mean that somebody being admitted is automatically admitted for 72 hours. It is for no longer than 72 hours. At time of discharge, individuals are connected with longer-term treatment options, such as, again, back to things like talk therapy or intensive outpatient. And lastly, that inpatient hospitalization is the most intensive part of mental health care, requiring the person to stay in a hospital setting for full time for a span of several days. We tell people that the average stay is roughly 3 to 7 days. It's used when someone is in immediate danger to themselves or others, or unable to function due to severe mental health symptoms. And treatments include round-the-clock monitoring, medication, therapy, and a safe environment for stabilization. So you'll notice I said lastly, but there's still emergency room on this slide. And that's because an emergency room is something we want to talk about. This is the environment that Martina and I work in, but it's not necessarily a treatment option, but it is there to connect you to treatment options. So if you're not sure where to go, what you need, you can always come to an emergency room and meet with a clinician like Martina and I, receive an assessment, and we can help you figure out which one of these levels of care is appropriate based on your particular situation at that particular time. There's no one size fits all for one person or even for one situation for one person. So the emergency room can help you navigate all of that and then get you connected with that level of care.
So as we just covered, the general overview of all different types of treatment, I did want to touch on some specific resources that we have here in West Michigan. Overall, there are several different organizations that offer talk therapy and medication management in Grand Rapids. Ways to get connected to those is that you're able to call the back of your insurance card, and they can connect you with mental health providers that work with your insurance. You can always do a Google search of the organizations, and you can go to your PCP, your primary care physician, and they always have resources to connect you with. The specific ones that I wanted to touch on here is the Anxiety Resource Center, which offers both virtual and in-person support groups, as well as in-person workshops here in Grand Rapids regarding anxiety and anxiety symptoms. Their website also has links to information and education on anxiety and anxiety symptoms. The next resource is the Behavioral Health Crisis Center through Network 180. It is actually a center that is connected to the main hospital in Grand Rapids, and you're able to walk in and get immediate support. As Sarah had talked about, that level of care, the crisis stabilization, which is the short term where you go and stay for 24 to 72 hours. They do offer that, but they do also offer, similar to she had said about the emergency room, clinicians and social workers that you can walk in and talk to immediately. And they can again help you work through some of the thoughts, feelings, and emotions that you're having, as well as connect you to resources. And they are open 24/7. The third one is Pine Rest Urgent Care. And Pine Rest, similar to the Behavioral Health Crisis Center and the emergency room, you are able to walk in when you're experiencing a crisis, but they can also connect you with outpatient services through Pine Rest as well. Oftentimes, through Pine Rest Urgent Care, you are able to see a psychiatrist the same day or very shortly after the same day to start medications. And they again can connect you with a therapist or other mental health provider. And then Pine Rest Urgent Care is connected to Pine Rest, which is an inpatient psychiatric hospital. So again, if you're feeling that you or someone you know are having thoughts of suicide, or just feeling that you're not able to function, Pine Rest Urgent Care can again help get you connected to that inpatient level of treatment as well. So then we have to touch on some crisis lines that you can access from your phone at all times. The first is the National Suicide Prevention Line, and that is 988. Again, similar to 911, but 988, and you'll be connected to a licensed mental health professional to speak with, again, the thoughts and feelings that you're having and help you work through a crisis. The 988 is the number that you can call at any time. There are some extra things that you can do, such as pressing 1 for the Veterans Crisis Line. As well as you can text this number here, 741-741, and you can text TALK for the suicide or just mental health crisis hotline and those licensed professionals. And then you can text FOLKS, and that is specifically for the LGBTQ plus population. We also included here the community mental health for Kent County, Ottawa County, Muskegon County, and Allegan County. Although these organizations often work with individuals who have Medicaid or do not have insurance, these are all crisis lines that you can call and are available 24/7 to speak with a professional. And again, if you don't have Medicaid or you have a different insurance, they can still help you connect with someone who can help you. And then I do know that a recording of this will be sent to save these numbers. Feel free to take a picture as well.
Okay, so some electronic resources. So we wanted to give you some options of things that you can always have on hand and in your pocket. There are traditional websites such as the Anxiety and Depression Association of America, National Institute of Mental Health, and the National Network of Depression Centers. So if you go to any of these websites, you can see blog posts or news articles that go in more in depth into different types of anxiety and depression. For example, seasonal affective disorder, when depression hits people as the seasons change. You can get connected to local support groups, even different community forums to interact and communicate with people going through something similar. We talked, about that PHQ-9 and GAD-7 and the importance of being able to track and monitor your symptoms. And there are a ton of different apps out there. One is Bearable, where you can track 2 things or 15 things from, diet, medication, whether that's your prescription meds or vitamins, your sleep. It includes a gratitude journal to help you, figure out what might be triggering those symptoms or an increase in those symptoms. It is a free app. The free version works great. You don't need a subscription, but there is a subscription option if you want to add access a few additional features. But again, the free app is fabulous. Another app is Calm. Again, that's free. You can choose to do in-app purchases or not, but it's a free app that can walk you through guided meditations. There's sounds like white noise or rain sounds or forest birds, things to kind of help slow your brain down. There's also guided meditative stories through that app as well. And I wanted to specifically highlight a podcast so that you can access it on numerous different types of listening platforms from online or wherever you get your podcast, if you're a podcast fan. And Nothing Much Happens is something that I have utilized at various points in my life. I find it incredibly helpful. And it focuses on bedtime stories. So it really focuses on that racing thoughts, insomnia, that sleeping piece, where the woman speaking runs through a bedtime story where, you guessed it, nothing much happens. So your brain hears something that's not everything that's in your head and can help lull you to sleep. Nothing Much Happens also has guided mindfulness and guided meditations as well. So shameless plug on something I love and think is fabulous there. So as you've seen today, mental health isn't just about diagnoses or crises. It's about knowing yourselves, recognizing patterns, having practical tools that we can use day to day, whether that's checking in on things like that GAD-7, PHQ-9, apps like Bearable, practicing skills like 4-7-8 breathing, or just knowing who to ask for help. The goal is the same, and that's making mental health and mental wellness something that we can talk about, track, and take action on. And I hope that Martina and I today have been able to give you a few tools to start doing that. And with that, we'll open it up to Q&A.
Thank you both. We will now transition into our Q&A session. If you haven't already, you may submit your questions using the Q&A chat feature at the bottom of your screen. So question 1, other than low energy or fatigue, are there any other physical manifestations of depression?
Absolutely. You want to take that one since you did
Mhm.
the depression part?
Yeah. Depression can manifest in a lot of different physical ways. Low energy and fatigue are, like I'd mentioned before, one of the main ones, but they can also manifest in almost illness type of ways. Like you can have gastrointestinal discomfort, headaches, migraines, again, those feelings of muscle tension. Um, Sometimes your body can just overall feel uncomfortable or feel heavy, almost like when you have a cold or you're sick, your body can feel heavy. So it can manifest in a lot of different physical ways.
In a lot of those physical ways, like Martina mentioned, you'll notice some of those things were things that I mentioned in talking about anxiety. It's going back to that Venn diagram that there is a lot of overlap. Yeah. Okay.
This individual had a bout with vertigo about a year ago, and they are experiencing anxiety about having it again. What can they do about this, and is this normal?
Absolutely not.
Yeah.
Will you say the first part about going about not experiencing this again? I'm sorry.
What can they do about not having this happen again? And yeah, is it normal?
I'm not really thinking about a way of like not having that happen again, right? I mean, it's different for everybody. Some things are gonna work for some people or not. I think that's a very hard one to call out about how not to have something happen again.
I would say that we can't specifically say how to make it not happen again, but we can definitely recommend what to do when it does and feeling those symptoms of anxiety. When you start to think about how it felt to have that vertigo or being anxious, again, that normal feeling of being anxious that it's going to happen again. And that would be referring back to those coping skills that we discussed, as well as having somebody to talk to about that and work through some of those feelings of, again, those normal feelings of discomfort and worry about having this stressful physical thing happen again. Um, yeah, I think, again, yeah, just managing your reaction to the anxiety, and that would be those coping skills that we talked about, breathing through those intense thoughts and feelings. Um,
And I think going back to, in the part about anxiety, we talked a lot about this feedback loop, right? Where we get stuck back into things and finding that when you worry about the thing constantly about it happening again, it can also, re-trigger that anxiety. So like worrying about it again is normal, but being able to talk about that worry and then find those coping skills that work.
Okay, so the next one is, what can I do to help my wife who describes herself as having anxiety? She refuses to say whether this is a self-description or diagnosed by a healthcare professional. She is definitely getting worse, but describes herself as getting healthier. She refuses conversation with me about anything, especially in front of another person. Seems like I can only wait until a crisis happens, and then it will become obvious that help is needed.
If you didn't hear it, Martina and I both just sighed. And a huge part of that is because this is something that we see, unfortunately, all of the time. And I don't say like I don't like using words like all, right? But it is pretty common. A lot of people, there's societal constructs around talking about our mental health. There's taboo in there and there's shame. And people often don't want to talk about what is happening. They find that short term bottling it up is easier, even though it creates a bigger problem in the long term. Sometimes, people in this scenario will convince their significant other or friend or family member to come into an emergency room to talk about what's happening. And we can recommend things like, outpatient treatment, partial hospitalization. But it's even if we get as far as getting somebody into the emergency room to do an assessment, that person still has to be willing to engage.
Mhm. I do think that Sarah's right. Unfortunately, if somebody does not want to engage in treatment, or isn't willing to have those conversations, there is not a way to force them to do things until it gets to a point where it is a crisis. And that is a fail in the system.
Absolutely. Yeah.
And it makes things very, very difficult. I'm sorry, go ahead.
I would say I would try and, maybe they're not comfortable talking with you, particularly with somebody in the room, but maybe there's somebody that you can tease out that they are comfortable talking with. Whether that's a family member or a close friend. Or maybe it's planting small seeds around things like talk therapy. Like, hey, if you don't want to talk with me about that, that's fine. Maybe you want somebody that's not that isn't in the middle of the situation, and planting seeds for something like a therapist.
Yeah, or even if it's something that you're comfortable with having conversations, especially after this, if this presentation was helpful of, oh, well, recognizing some of those symptoms, right? I noticed that you are having trouble sleeping. And I worry that that may be from some of these racing thoughts that you've had. Not gently trying to identify some of those things. And sometimes for people, it can be hard to recognize, I'm having trouble sleeping, but for the person, it can be hard to put together, why am I having trouble sleeping? And sometimes pointing those things out in a gentle manner can be helpful.
Another thing, you can plant a seed on something like journaling or some of those what is the word I'm like thought recording, or apps like Bearable, right? Like if maybe they're just saying they feel that their symptoms are better because it's easier to say that and not address the issue head on, or maybe they're really not realizing it and them having a way to track it and notice, oh wow, I really thought I was getting better and I'm not.
Mm-hmm.
So those are various different approaches that you can take with different people. Some people are going to be receptive to one of those and not others.
Yeah, it's definitely a very difficult situation for you to be in. Again, as I said, that this is a part of the system where I do feel that there is a fail. And sometimes it does come to a crisis. And of course, I hope that's something that can be avoided, but I do want to acknowledge that this is a very difficult situation for you.
Do you know if Medicare covers talk therapy?
Yes. Mm-hmm. Yes. Medicare does cover talk therapy. Ultimately, what organization differs. So I would recommend calling the back of your Medicare card, and they will be able to connect you with therapists who take Medicare, as well as you can go to a website called psychologytoday.com and put in the specific type of Medicare that you have, and a list of therapists that take your insurance will come up.
One place that might take Humana Medicare might not take another type of Medicare. So those would be two great ways to find out for that particular type of Medicare, but they do, they cover it and it is out there.
Mm-hmm.
Next one, it's not uncommon for my anxiety and depression to get so bad once or twice a year that I have considered more intensive treatment, but I have the barrier of childcare with my 3 children. Is there something that's more intensive that would be condensed to school time hours? I want to do outpatient, but they seem to get done well after needing to pick up kids from school.
Gotcha.
Yeah. So the two that immediately come to mind are the intensive outpatient as well as the partial hospitalization program that we talked about. And that one specifically is typically done between, I want to say, like 9 and 3 is a partial hospitalization program.
Depending on what age your kids are, Pine Rest does have a daycare option for kids of certain ages for the partial hospitalization program. So that's something to look into. And then, that intensive outpatient program. So one that, again, like Martina's saying, call it your insurance card is a big one, because something that's coming immediately to mind for me is here in Kent County, if you have Medicaid and can go through Network 180, they have a really great program, a crisis program, where you can, see a counselor, see a psychiatrist, do all of that 3 appointments ish a week. That can happen during daytime hours as well. So there are different levels of treatment that can go during school hours. I think some partial hospitalization programs will be difficult, but again, depending on your kids' age, Pine Rest does offer some daycare.
Yep, and the hospitals that offer those here in Kent County, I believe in all of West Michigan, are Forest View and Pine Rest, and you're able to call them both and to get the hours. I do believe Forest View is 9 to 3. It all depends on the school time as well, but those are 2 great options.
With my depression, I'm always finding ways to get out of family gatherings. This has been very upsetting for my mom. How do I address this with her? My main issue is with certain family members that makes getting together very difficult. How do I address the issues?
That is a very complex problem.
I think, again, like Sarah said, that is something, there's a lot of layers to that. I think in terms of addressing it with your mom, if you're comfortable, to be open and honest with her about how you're feeling. Sometimes, sharing the symptoms that you're having, education on depression and how depression affects people, ultimately is how I would recommend having that conversation with your mom. Unfortunately, that not everybody has, like we've kind of talked about, is stigma with mental health, which there should not be at all. But sometimes having those conversations can be very difficult, because of, if I don't know your mom's understanding of mental health, and how that reaction will go.
Yeah, a lot of times it is providing education to other people. Like, this is what it does. This is, it's not me being lazy. It's not me being difficult. Depression really does impact people physiologically and psychologically. Like, this isn't something that I can control. It's up to you to, use those coping skills and seek treatment to help manage those things. But again, you also can't control other people's behavior at these family gatherings too, right? So knowing when is and isn't a good time for you to be there or to leave, maybe discussing, I can go for the first hour, and bartering, if you will. But again, you need to do what's best for you and your mental health. And that's going to look a little bit different for everybody in that situation.
I have 2 more questions if we have time. First one is people who suffer from RA often have a lot of pain. Can they also be anxious and depressed from that?
Absolutely. Absolutely.
Yeah.
Anxiety and depression can stem from nearly anything, right? One situation that somebody finds very manageable, another person can find debilitating. Something that we see often in the emergency room with people with anxiety and depression is related to chronic pain. It is a big one. And that's managing your symptoms with your provider and or pain clinic, if that's something that is utilized, as well as working with a mental health clinician. But chronic pain and symptoms related to things like RA are very common.
And lastly, how to best treat depression holistically besides medications?
They're spiritually, right? For some people, that's religion. For some people, that's a silent walk in the woods. Um, you know,
Yeah,
my brain just went blank.
that's okay. Yeah, I think that's a great example. I think that you can do talk therapy without medications, absolutely. You can also, again, like I had mentioned before, that website Psychology Today. There's therapists all over that specialize in holistic treatment, and may have some similar views to you as to how you feel about mental health and the treatment. And you're able to connect with somebody like that. Because again, you do not need medications to engage in talk therapy.
Some people utilize things to adaptogenics, which are herbs that help your body adapt to different situation. Common ones are ashwagandha and tulsi, and those are again they're both herbs rather than relying on medication. So there are things like that can be utilized as well. And like Martina said, there are counselors and other clinicians out there that are very much in support of that and are familiar with utilizing things like that. And it's about that like clinician shopping, right? It's finding somebody that can help guide you through what your approach is. And I can almost guarantee you there's somebody out there that does.
Yeah. And then again, just utilizing coping skills as well. Especially if there are certain ones that work best with you. But there are, we talked a lot about yoga and meditation and progressive relaxation, things that work to calm your body and your physical body as well.
Yeah, focusing on the somatic release and those somatic symptoms can help a lot.
Well, thank you again, Sarah and Martina, for your presentation and insightful Q&A. To all our participants, thank you for joining us, and we hope you have a good evening.